Hey, my name is Jeremy. I'm going to show you guys how to use an ultrasound to start an IV. Oftentimes on shifts, we're called to obtain access on some difficult sticks, and this is a great tool to learn. Okay, on this monitor here, we've got our gain and our depth that we learned in our other video. You can change that back and forth. You've got your indicator light here, which lines up with your indicator here. And just be aware that you can change your indicator to different sides of the screen. So if you grab an ultrasound and you don't realize where your indicator is at, you could be misled. So just pay attention to that. Okay, I've got my subject here, and most ultrasound IVs are done in the upper extremities. Usually the nursing staff has exhausted the hand, wrist, and forearm. You can still find some there, so it's always good to look and see what's superficial. But most of the time, the difficult ones, you're going to be able to target the basilic and the brachial veins. So you want to go higher up on the arm and look for those veins, because commonly those are the deep veins that you can't visualize on gross anatomy. And just for demonstration purposes, we're going to use the forearm here just so you guys can better visualize the ultrasound probe. So our first view is going to be a cross-sectional view. We would put a lot of jelly on the arm, and this is what that view looks like on the ultrasound screen. And we're just going to survey the arm. The ideal vein is going to be the most superficial vein that is large enough to cannulate, where I don't have to go super deep if I don't have to. As I like to say, I like to shop before I buy. So I like to survey the whole arm and find the most suitable vein for this procedure. Okay, so now I want to look at the surrounding structures, and I really want to know the difference between an artery and a vein, so I know that I'm targeting the right vessel. There are several different ways to identify an artery versus vein. The first one is compressibility. So I always like to compress, and it's good to use all the different tools at your disposal so you don't get fooled during the procedure. So first off, I like to see how compressible it is. Arteries typically do not compress very well, as demonstrated here. Secondly, you can look at the wall thickness. You've got the different layers of the artery, the tunica intima, and the smooth muscle of an artery is just going to be so much larger than a vein. And then finally, we can use Doppler flow to identify any pulsatile flow that is likely to be your artery. So based off of those three things, that should help you avoid accidentally cannulating an artery. Now, the other part is just accidentally missing the vein just due to location. And notice if we just keep moving the probe up the arm, we found a nice location where the vein is sitting on top of the artery. Previously, it was sitting to the left and right of the artery, and this gives you no margin for error laterally when trying to do the IV. So now that the vein is sitting on top of the artery, it's going to give us a much better chance to get this on our first try, and also limits the risk of hitting an artery laterally. If we go too deep, we could still hit it, but this is just a much better candidate, which is why we take our time to find the best vein possible. Now that we have a good candidate with our vein here, we're going to rotate the probe and look at it from a longitudinal view. And what we're looking for is for the vein to stretch across the entire screen in its entirety. From the other view, you can't tell if it's going to take a quick left or right turn. And that red arrow was just the artery underneath the vein. And you can also turn on a guide that runs down the middle of the screen, and that guide will correlate with the middle of the arrow on the ultrasound probe. So it's important to line up your needle exactly in the middle of the arrow so you know where to expect it to enter the skin and the field of view on the ultrasound screen. All right, so now I'm entering the skin with my needle, and you can literally see the vein start to compress as I'm over top of it, and that's a good sign showing that I'm in the right location. And you can make little micro adjustments to make sure you're collapsing it in the middle of the vein. And now right now you can see that needle tip is right in the middle of the vein and just sitting in that vessel. So now as I'm still in the skin, I'm going to rotate my probe. I'm not going to retract my needle as you see in this demonstration here. The needle's still going to be inside the skin. And as I rotate, I'm going to see that vein in a different plane. And notice my indicator is pointed to the right here, which means when I'm in the skin, the needle is going to be going right to left in this demonstration. And I want to make sure I can see my needle tip at all times. If your ultrasound is a little bit off, you could be deeper than you think you are. But here we see the tip of the needle, and we're seeing it actually drive into the vein. And now we can just slide our catheter over. Notice that we advanced the catheter, our needle stayed put, and as soon as we knew we had successful cannulation, we retracted the needle altogether and left the catheter in place. And now we can just double check in a different view. We go back to our cross-sectional view and we can see the catheter sitting nicely inside the vein, and we know that the artery is unscathed here and there's nothing inside the artery, so we did a successful cannulation. Okay, and that is how you do an ultrasound IV. In this demonstration, we went back and forth between our different views multiple times. I know some people just learn one view and that's how they get most IVs, but I think that it's important to master both views, and that helps you troubleshoot more and helps you get more complex IVs later on in the future. And these skills highly translate over to doing a central line, so it's really good to master both of these views. Thank you guys for watching, and stay tuned for more videos.